Right now, while you're watching this video, dozens of older adults are being diagnosed with dementia. Statistically, that's about one new case every single minute. But here's the part almost no one is talking about. In many situations, the culprit may not be age, genetics, or bad luck. It could be sitting quietly inside the medicine cabinet. For decades, seniors have been told that prescription drugs and even over-the-counter pills are safe, routine, and necessary. But mounting evidence shows that certain medications may silently damage the brain, shrinking areas critical for memory and focus. Studies reveal that within just a year, some drugs can shrink memory centers in the brain by more than 25%. And the pharmaceutical industry? Well, they've known about this for years. Yet billions in profit are made selling medications that may accelerate memory decline in millions of older adults. In fact, one major study found that a common class of medications increased dementia risk by nearly 50% in seniors after only 2 years of use. In this video, we'll reveal the 9 medications most strongly linked to memory loss and dementia. We'll count them down from number 9 to the single most dangerous, and I guarantee that at least one of them is in almost every senior's medicine cabinet. Stay with me because number 3 is one of the most commonly prescribed drugs for something as routine as mood. Yet research shows it directly disrupts the brain's memory circuits. But before we dive in, let me ask you, what medications are you currently taking every day? Have you ever noticed brain fog, forgetfulness, or sudden confusion after starting a new prescription? Leave a comment below. I read every single one. Your experience might save someone else's mind. Now, let's begin with number 9. Medication 9, Diphenhydramine, Benadryl and PM products. You probably know this one. It's the little pink pill millions rely on for allergies, colds, or a good night's sleep. It's inexpensive, over-the-counter, and often found in nightstands all across America and the UK. But diphenhydramine belongs to a group of drugs called Anticholinergics, which block acetylcholine, the neurotransmitter your brain relies on for forming new memories. Seniors are especially vulnerable because aging naturally reduces acetylcholine levels. By further blocking this critical chemical, diphenhydramine can impair the hippocampus, the very region of the brain that stores new information. And the scary part? You may not notice it right away. It shows up gradually as brain fog, trouble focusing, and forgetfulness. A recent study found that seniors who regularly used anticholinergic drugs like diphenhydramine had a 54% higher risk of developing dementia than those who didn't. What to do instead? If you're using diphenhydramine for sleep or allergies, ask your doctor about non-sedating alternatives such as loratadine, Claritin. These do not cross the blood-brain barrier and are far safer for long-term use. Medication 8. Proton pump inhibitors, PPIs. Next up are drugs like Prilosec, Nexium and Prevacid. These medications are commonly prescribed for acid reflux, GERD, and heartburn. Many seniors stay on them for years, sometimes decades, because symptoms return as soon as the pills are stopped. But PPIs come with hidden costs. They reduce the stomach's ability to absorb vitamin B12, magnesium and calcium, nutrients vital for brain and nerve function. Deficiency in B12 alone can cause confusion, forgetfulness, and even depression. In one extensive study of adults over 75, long-term PPI users had a 44% higher risk of dementia compared to those not taking them. PPIs have also been linked to increased buildup of amyloid plaques, the sticky proteins associated with Alzheimer's disease. What to do instead? Ask your doctor about gradually tapering down, possibly replacing PPIs with safer options like H2 blockers, such as famotidine, sold as Pepcid. Natural supports, such as D-glycyrrhizinated licorice, DGL, can also soothe the stomach without harming cognition. Medication 7. Bladder control. Medications, oxybutynin and similar drugs. For many older adults, bladder urgency or incontinence is a daily struggle. Medications like oxybutynin, Ditropan, are often prescribed to help. However, these drugs once again block acetylcholine, and, unlike milder anticholinergics, oxybutynin crosses the blood-brain barrier with ease, directly affecting memory centres. A major study found that seniors who used bladder medications for over a year had a 49% higher risk of dementia. Patients often report fogginess, misplacing items, or struggling with conversations, all too often written off as just aging. What to do instead? Safer alternatives exist, such as mirabegron, Mybetriq, which works differently and does not interfere with acetylcholine. Medication 6. Statins. Statins like Zocor, simvastatin, and Lipitor, atorvastatin, are among the most prescribed drugs in the world. They're given to millions to lower cholesterol and reduce the risk of heart attacks. But cholesterol isn't just about heart health, it's critical for the brain. Nearly 60% of the brain is made of fat, and cholesterol is essential for maintaining the myelin sheath that insulates and protects nerve fibers. Research shows that long-term statin use, especially higher doses, may increase the risk of mild cognitive impairment, with some patients reporting sudden memory lapses, trouble recalling names, or forgetting familiar routes while driving. Not all statins are equal. Some, like pravastatin or rosuvastatin, are less likely to cross into the brain and may pose fewer risks. What to do? Ask your doctor about adjusting your dose or switching to a less brain-penetrating option. Medication 5. Benzodiazepines. Valium, Xanax, Ativan. These drugs are prescribed for anxiety, stress, and insomnia. They calm the brain by boosting GABA, a neurotransmitter that quiets overactivity. At first, it feels like a miracle: peaceful sleep, reduced anxiety, and calm. But long-term, benzodiazepines act like a chemical sedative that slows learning, dulls emotions, and fogs memory. A 6-year study found that seniors who used benzodiazepines for more than 3 months had a 51% higher risk of Alzheimer's disease. Worse, when people try to stop, withdrawal symptoms can be brutal, making it feel impossible to quit. What to do instead? Never stop benzodiazepines abruptly. Instead, work with your doctor to taper slowly. Safer alternatives include buspirone for anxiety or cognitive behavioral therapy for sleep. Medication 4. Amitriptyline, Elavil. This older antidepressant is still widely prescribed for pain, migraines, and insomnia, but it's one of the most potent anticholinergic drugs still in circulation. By powerfully blocking acetylcholine, it directly sabotages memory and focus. One extensive study found that seniors on long-term amitriptyline had a 54% greater risk of dementia, and the danger increases with higher cumulative doses. What to do instead? For nerve pain, safer alternatives include duloxetine or gabapentin. For sleep, melatonin or low-dose doxepin may be options. For depression, modern SSRIs like sertraline are generally safer. Medication 3, paroxetine, Paxil. Unlike other SSRIs, paroxetine uniquely has anticholinergic properties. That makes it especially risky for older adults. Studies show seniors on paroxetine have higher rates of short-term memory loss, poor attention, and even personality changes compared to those on other antidepressants. What to do instead? Avoid paroxetine altogether in seniors. Safer alternatives include sertraline or escitalopram, both of which are effective without the same memory-sapping side effects. Medication 2. Antipsychotics, risperidone, quetiapine, olanzapine. Here's where things get very concerning. Drugs originally designed for schizophrenia and bipolar disorder are now often prescribed to seniors for sleep, restlessness, or behavioural changes related to dementia. But in older adults, antipsychotics increase the risk of stroke, sudden death, and severe cognitive decline. One large study showed a 71% higher risk of worsening memory loss within a year. Families often describe their loved ones as suddenly zombified, emotionally flat, unresponsive, and no longer themselves. What to do instead? Always question why an antipsychotic was prescribed. Often, behavioural issues can be managed with better routines, pain management, or environmental adjustments instead of heavy drugs. Medication 1. Anticholinergic, Polypharmacy, taking multiple anticholinergic medications at once. Imagine this: a senior takes Diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each drug chips away at memory slightly, but together the burden compounds and the risk skyrockets. Research tracking over 280,000 older adults found that those with the highest anticholinergic load had more than double the risk of dementia compared to those with the lowest. The good news? Drug-induced dementia is often reversible. By reviewing and reducing medications, many seniors regain clarity, focus, and even sharp memory within weeks or months. What to do instead? Request a complete medication review from your doctor or pharmacist. Ask about the anticholinergic burden of your prescriptions and work on reducing it wherever possible. There you have it, the 9 most dangerous medications linked to memory loss and dementia in seniors. Remember, the goal isn't to scare you into throwing away your prescriptions, but to empower you to ask questions, explore alternatives, and protect your brain. We'd love to hear from you. Which of these medications are you currently taking? Have you noticed any brain fog or changes in memory? Will you discuss with your doctor the review of your prescriptions? Share your thoughts in the comments. If you found this video helpful, then please like, subscribe, and share it with a friend. Thanks for watching, and take care of your mind. It's your most valuable asset.